So, GOG213, as I mentioned, is a trial that has two primary endpoints. One was to address the role of Bev added to chemotherapy in platinum-sensitive recurrent ovarian cancer patients, and the second was to evaluate the role of surgical secondary cytoreduction in the same setting. And so, when the trial was opened, we allowed both patients that were considered surgical candidates and those that were not considered surgical candidates to participate. When we finished the first question about the role of bevacizumab, we then only allowed patients to enroll in the trial to address the surgical question. And this is a very old, question we've been trying to address for almost 30 years. So the fact that we had now 3 phase 3 trials that are addressing the question reporting is a momentous accomplishment. So we're really excited to have this data to go on. But I think one of the key pieces of understanding Desktop 3 and SOC1 in the context of GOG213 is really about the evolving role of adjuvant therapies. And we're obviously going to dig into these when we talk about what's the best treatment for these patients with recurrent disease now that we have these biomarkers. And so this is all, kind of new. And at the time, we were evaluating the role of anti-angiogenesis-based therapy, and we were able to show that improved not only progression-free survival, but also overall survival. So to separate those two questions is actually probably an incomplete picture. And I think that GOG213 represents, or at least highlights that potential disconnect, because the treatment standards are changing while we're doing these very long, slow to accrue trials like these surgical trials.